How's it going, guys? We have a medium difficulty question in microbiology. 40-year-old dude from Connecticut, 1 year history, 1 year history. What the fuck am I saying? 1 week history of scleral icterus and fatigue, no past medical history, occupation, unremarkable. He goes kayaking, probably hiking at the same time. Went to the Cayman Islands 2 years ago. It's notable, but it's too long ago. It's not going to relate to this patient's presentation. Mildly febrile, 9.5. And then you've got these Maltese crosses on the left, which is very buzzy for one of these diagnoses here. And then you got these ring forms as well within RBCs, okay? What's the diagnosis? Choice A, anaplasma is fucking wrong. Protozoan, unicellular eukaryote. There's two things they can ask you on USMLE. The first is it causes contact lens infections. The second is it's spread by the same vector as Lyme disease. That's what they'll ask. In other words, it's spread by ixodes. So the four things spread by ixodes for USMLE: number one, Borrelia-Burgdorferi Lyme disease; number two, Babesia; number three, Ehrlichiosis; number four, anaplasma. Wrong fucking answer. Choice B, Babesiosis, Babesia, correct answer. So two things here. The first, this image on the left, the Maltese crosses, very buzzy. Some of you knew this instantly, that's fine. That's sort of 20% what I care you know about. The 80% point that's mega high yield is Babesia causes a hemolytic condition that sounds like malaria, where you get these ring forms, except the patient will not have left the United States, okay? So if we did not give you the Maltese crosses here and we only gave you the ring form, and we said that this dude went to South America or Africa within the past few months, answer, malaria. However, he hasn't left the United States recently. So this is Babesia. And he goes hiking, kayaking. Okay, so he probably had a tick bite. USMLE doesn't have to say he had a tick bite. Some people don't realize they were bit by a tick. Okay, so this is Babesia. Hemolytic conditions similar to malaria in a patient who has not left the United States. Spread by ixodes tick. Got it? Now, let's just hop through the others. Choice C, Ehrlichiosis is fucking wrong. So, mega low yield, okay? What I could tell you is that it causes a rash, and they'll tell you some 26-year-old dude was, he had a circular rash that was not a target rash, and his dog often sleeps with him, and there was a tick found on the dog. And this dude, he's got phagocytes where on a smear there are berry cluster organisms or morulae observed within the phagocytes. So it's going to sound sort of like Lyme disease, but they're going to tell you that there are morulae or berry cluster organisms. That's Ehrlichiosis. That's not Lyme disease. Choice C, wrong fucking answer. Choice D, Borrelia-Burgdorferi is fucking wrong. Okay, so you're not going to see these images with blood smear. So Lyme disease, apart from the erythema chronica migrans, your target rash, a couple points I can make. Number one, it doesn't have to be a target. It can just be erythema migrans where it's circular without a target rash. That confuses some students. Okay, so the target can develop, but it doesn't have to be. The second point is that Bell's palsy is the second highest yield finding for Lyme on USMLE. So especially for 2CK3, if a patient has Bell's palsy, the next best step in management is going to be one of two things. Either no further diagnostic studies indicated. You do not do nerve conduction studies for Bell's palsy. It's a clinical diagnosis. If they don't live in an endemic area. If they live in an endemic area for Lyme, the next best step is Borrelia titers. Okay, and then Lyme disease, they want you to know the treatment, which is doxycycline. Except for children 8 and younger and pregnant women, you don't give doxy. You give amoxicillin or ceftriaxone. All right? There's more detail. I mean, ceftriaxone tends to be for more disseminated Lyme, whereas amoxicillin is more minor. But they can have either as the answer. Wrong fucking answer. Choice E, and of course the elephant in the room, you should know this already though, but Borrelia is Spirochete. Okay, so when we talk about Treponema pallidum syphilis, Leptospira interrogans, and Borrelia burgdorferi and Borrelia recurrentis. These are spirochetes. So what they can do is give you an easy presentation for Lyme, and you're like, oh, obviously it's Lyme. And then they'll ask you which the following is most taxonomically similar to this patient's, to the pathogen causing this patient's presentation, and the answer could be Leptospira interrogans, or it could be Treponema pallidum for syphilis. As I already said, wrong fucking answer. Choice C, malaria is fucking wrong. So Plasmodium falciparum, so unicellular eukaryote protozoan, and Vivax nogali go latent in the liver. They cause what are referred to as hypnozoites. USMLE can write this as the exoerythrocytic phase. Exoerythrocytic phase, outside the RBC phase, okay? And you need primaquine to kill hypnozoites. And Plasmodium falciparum is the worst one because it causes cerebral malaria with microthromboses. And Plasmodium falciparum can cause hypoglycemia. Sounds very weird. They want you to know that. Wrong fucking answer.